Welcome back to the micromodule series, Understanding Bias in Epidemiological Studies. In this module, we will be focusing on the last method for controlling confounding, which is random allocation. The objectives of this module are to explain how random allocation can help control for confounding and explain the limitations of random allocation. Random allocation is an essential procedure of randomized control trials. It means to randomly allocate study subjects to intervention and control groups after recruitment. The allocation is not determined subjectively by researchers, but through a random mechanism, such as computer-generated random numbers. Therefore, each subject, along with his or her characteristics, will have an equal chance of being placed in either group, resulting in even distribution of all characteristics such as age, sex, and health status of subjects across the groups. In other words, all factors, including potential confounders, known or unknown, will be well balanced between groups, especially when sample size is large. Thus, confounding bias can be removed or reduced to minimum. Let's have a look at an empirical example of randomized control trial that evaluates the efficacy of ramipril, an antihypertensive drug, as compared with placebo for preventing cardiovascular disease. The subjects are randomly allocated to ramipril or placebo group. We can see that after random allocation, all patient characteristics are well balanced. The mean age, blood pressure, and heart rate are identical between the two groups, and differences in the proportions of females and people with pre-existing coronary artery disease and stroke are very small, which can be regarded as random variation that would not actually affect the results. Thus, there will be no confounding caused by any factor and no need for using other methods to control for confounding. The limitation of random allocation is that it can only be used in studies that evaluate the effects of interventions assigned to study subjects. The inherent characteristics of study subjects, such as age, sex, and history of stroke, are fixed and can by no means assigned or randomly allocated by researchers. The interventions must be potentially beneficial according to current knowledge, because it is not ethical to assign potentially harmful interventions to subjects. For example, it is unethical to assign non-smoking subjects to a smoking group and require them to smoke for the study. Furthermore, random allocation may not achieve perfect balance between groups if sample size is small. For example, in an extreme case with only 2 subjects, one male and one female, random allocation has no advantage over subjective allocation at all in terms of control for confounding, as both approaches will produce 2 highly imbalanced groups. Okay, in this module, we discussed how random allocation can help control for confounding and the limitations of this method. This marks the end of the micromodule series, Understanding Bias in Epidemiological Studies. Thank you for listening.